implemented the employee-initiated severance package. And that is in an effort to relieve the older generation, to make space for your own children to come into the system and find employment. We live in a country where the figure fluctuates between 26 and 27% of our youth that is unemployed. Surely, this cannot be a good sign. Surely, as parents, you would want to see your children employed. And we have to sacrifice at some point to create that space for these children to come in and be members of DENOSA. And I sit with colleagues on the opposite side of the table who are very reasonable people, who are not sensationalists, who look after the interests of the employees of government because those are their members. And be rest assured, I will not take decisions where I would not have taken my partners, which is Labour, on board in some of these discussions. MEC Ramokgopa, Dr. Benson, Deputy President, Deputy Chairperson, you hold so many titles, senior staff of government that is accompanying both me and the MEC, but also senior staff that is accompanying the CEO of the facility, precious caregivers of our land, good morning. It is, my watch is slow. Good afternoon. Let me start by greeting all of you and appreciate all the women sitting here today, because I really do not see men who are in this profession. I think I see one man. Or is there another man? I greet you too. Being in this profession that is a calling, as MEC Ramokgopa says, and to acknowledge the sterling work that you perform under very trying circumstances on a daily basis. Trying in the sense that, as the Deputy President said, sometimes there are no syringes. I'm not sure if she's exaggerating, but I think the point that she's trying to put across is that sometimes there are no facilities to help our people. Sometimes there is no medicine to administer to our people. Sometimes the files do not come timeously for you to know the history of the patient that sits before you. Sometimes the facilities are such that they cannot carry the burden of the number of patients that we have to look after in these hospitals. So with what she said, she made the example of a syringe, but it is those trying circumstances that we would like to acknowledge you for embracing and working within those trying circumstances. But also working under circumstances that have become so much more unsafe. That from time to time you get threatened by patients. From time to time you get threatened by families of patients. And in understanding the pain and the anxiety that goes on in the minds of families of patients, that does not give them the right to attack you either physically or verbally when you are in line of duty. We saw a few weeks ago a video that went viral of a student doctor that was being harassed by a group of men who had come to see a patient who was a family member. No amount of frustration can justify an attack on any of you. In particular, I would also like to single out and acknowledge those who will be receiving their Excellence and Long Service Awards today, and thank them wholeheartedly for their commitment and dedication to improving the lives of our people. Among them are people who occupy the category of general workers in the system and who most are often forgotten when these recognition awards are conferred on outstanding workers. I am pleased that Rahima Musa has taken the initiative to recognize the sterling service, and I would like to encourage the rest of the institutions to do the same. Such dedication contributes immensely to the rich legacy of our stalwarts and forebears in the nursing profession, such as Me Charlotte Maxeke, Me Cecilia Makiwane, Me Albertina Sisulu, and also the late departed Mama Winnie Mandela. Fellow compatriots, we meet at an important time when the country and our nation celebrates the centenary of Mama Sisulu and also of Ubabu Nelson Mandela. She was herself a nurse who left an indelible mark in the history of our struggle and freedom, but also in the sector in which we operate. The progressive constitution of our land.
All right, that's the Public Services and Administration Minister, Ayanda Dlodlo.
All constitutes products of Mama Sisulu and her generation's sterling work and efforts as freedom fighters and lovers of their toiling masses. These tributes to all these women were outstanding public servants would not be enough without reflecting on the sterling and selfless contribution of Umama Winnie Mandela, who as well dedicated her entire life to the career to the service of her people. When she became the first black medical social worker more than 6 decades ago, Winnie Mandela distinguished herself as a selfless public servant and a lover of humanity. Abandoning a lucrative scholarship to study abroad, she chose to spend her life among the needy and vulnerable and to become a foot soldier in the fight against dehumanizing poverty, degradation, and self-hatred. This kind of courage and commitment should inspire us to serve our people with humility, dignity, commitment, and a sense of accountability. As we gather here today, we must recommit to the pledge to serve our people with pride and dignity, to follow the sterling examples of Umam Sisulu and those of her generation. Let me also take this opportunity to recognize the important contribution that the Nursing College is making in upscaling the skills profile in the health sector. I'm proudly informed that the college is only one in the country that provides for specialist training in about 10 programs in this profession, and that it has the highest output of specialist nurses in the country. In this regard, it plays a large and critical role in enabling service delivery to the country's most critical, ill and injured, from before birth and throughout all the different phases of life to the end of their lives. We must also take pride in such important initiatives which contribute to the much-needed skills profile in the public service. Our quest to professionalize and turn around the image of our public service will benefit immensely from these important programs and initiatives. It is in the same vein that we launched the graduate recruitment scheme a few weeks ago. The scheme is one of the practical initiatives proposed by the National Development Plan towards the achievement of a goal to make a public service a career of choice. As we're all aware, the NDP highlights the importance of adopting a more long-term approach to developing skills and professional ethos that underpin a developmental-oriented public service. The NDP has observed that young people seeking to enter a career in the public service often find it difficult to identify a suitable entry point in the system. It is also true that public servants and departments struggle to identify and develop young talent from the ranks of the youth and unemployed graduates across our country. The introduction of this scheme, therefore, will provide a more coherent entry route for young public servants who will provide targeted training and help to build the skills and professional ethos required for the sector. Deputy President, if we were looking at a large-scale reduction of numbers of up to 30,000, we wouldn't be talking about recruiting new skills into the public service. While on the important subject of skills, we must also attend to the need of the infrastructure, refurbishment, maintenance, and development in our institutions. Without adequate infrastructure, we will not succeed in our objectives to deliver quality services to our people. We have also taken note of the dire needs of this particular hospital, and we should, together with my counterpart, make means to meet these challenges to enable the institution to deliver services to its people. One of the things that I've said to the CEO this morning is that as you work in these very difficult circumstances, the one thing that you always forget as nurses is your own well-being. And I have asked that the department must come back here and craft an employee well-being program that will suit the needs of nurses in the public sector. Having said that, I would like to conclude by reflecting on the story that is making the rounds about the fate of public servants and the misplaced allegations of these planned retrenchments. As I said in a statement I issued in the media a few days ago, the report is a complete misrepresentation of government program in relation to the macro configuration of the state and the initiatives proposed to manage the public sector wage bill. Its intended objective is to create unnecessary and dangerous panic not only in the public service but the entire country, and it must be rejected with the contempt that it deserves. This sector is one sector that is understaffed, and I acknowledge that. You also have the police service that is also grossly understaffed, and I acknowledge that. The Department of Home Affairs is hugely understaffed when it comes to immigration officers. So throughout the public service, Deputy President, we have shortage of staff. In the technical fields where the skills are most required. What will then happen for the younger ones that will not exit the system for us to be able to contain this huge wage bill is that we will offer retraining, upskilling, so that we divert people from administrative positions and fill those technical skills gaps that exist in the system. So if people are going to leave, they will not leave because they've been retrenched. They will leave because there is an offer placed on the table for early retirement, which will attract no penalties, but also from the employee-initiated severance package, where you will come to us to say, I want to exit earlier, what are the possibilities? And we will then advise you so that you do not lose out. There is no such a thing as a retrenchment of 30,000 people in the public service. The reality is that the President's call to restructure government in order to enhance service delivery and make the public administration more effective and efficient by removing superfluous functions and structures does not include an option of retrenchment as reported in the newspapers. Once again, let me congratulate the employees who have been awarded the Long Service Excellence Awards and also encourage the rest to emulate their example. The public service needs a cohort of dedicated individuals like you who are professional, skilled, and committed to the service of our people. In turn, as government, we will make your work areas very comfortable so that you can be able to effect on your calling. Thank you very much.
Thank you very much, MEC, and thank you very much, Minister. You know, I won't be long, but my take from both speakers is that both of them, you know, they acknowledge the good work that we nurses are doing. You know, they also allay our anxiety regarding the retrenchment that was, you know, circulating of 30,000 employees. But I'm glad that there is a relief program that the Minister is going to offer about the early retirement. Really, that allays our anxiety. And also, I'm glad that they looked into the issue of nurses not being protected, the threats that the nurses are facing in our work environment. Thank you very much. You know, they also looked at our challenges, you know, overall, our challenges as nurses, the shortages of resources, the shortages of material resources, human resources, and also staff shortages in the public sector at all, not only in the nursing fraternity. Thank you very much, ladies, you know, We really appreciate what you are doing for us. Thank you so much. I will call upon the next speaker, which is Mrs. Ramatlafi. She's going to do the meaning of the lamp for us. Over to you, Mrs. Ramatlafi.
Program Director, thank you for this opportunity.